Quite often in GP land we have to deal with received wisdom, sometimes referred to as old wives' tales, and sometimes they're not a million miles off the mark. A good example is an apple a day keeps the doctor away. I'm not sure, unless you're throwing it at me, how useful a single apple is going to be, but there is a lot to be said for eating your fruit and veg, particularly apples. Just an apple has got vitamin C, we've got fibre, we've got the pectins, we've got a lot of goodness in that apple. So that is a good example, received wisdom that's beneficial. However, sometimes that received wisdom needs to be updated. And a good example is with regard to the comments you'll get with regard to your knees, particularly that you shouldn't be running and things like that as you get older because you're going to wear your knees out. That's rubbish. Now, I don't want to seem quite so dismissive of that, but actually the forces that go through the knee as you're running, as you're walking, as you're jumping, as you're being active, help move the fluid around within the joint, that synovial fluid, and essentially feeds the tissues that make up the cartilage within the joint. So definitely with your knees, it's actually more a case of if you don't use it, you're going to lose it. So keep in mind that people will still say, what about wear and tear on the joints? Now, in some cases, that can be a problem, but that's normal if we're carrying an injury or we've got an imbalance. So rather than the forces going down perfectly equal on the joint, we're hitting with a corner perhaps on the knee. That's more likely to cause a little bit of wear and tear, and that might contribute to the osteoarthritis. Now, I've said contribute. The reason why I say that is another set of bones that get frequently affected by osteoarthritis is the hands. And your hands aren't weight-bearing joints. You're not putting a huge amount of force through these very small joints. And in spite of that, we can get very clear osteoarthritis changes as we get older. In fact, these swellings to the small joints in the hand can be called Heberdean nodes. So these are osteophytes due to osteoarthritis. So if we're saying use your joints, otherwise you're going to lose them, where's the problem coming from in the hands? Well, we know a lot about rheumatoid arthritis, these autoimmune issues where the joint is being destroyed by the body. There's a growing amount of evidence to suggest that some of the features or some of the bits that lead to osteoarthritis might actually be inflammatory in nature, and diet might play a strong role in that. There's some evidence to suggest that having a more vegetarian diet can reduce the risk and certainly the discomfort of osteoarthritis. So maybe the whole idea of an apple a day keeping the doctor away isn't quite as far off the mark as it could be. Take care and we'll see you in the next one. Cheerio.